we're in turbulent times at the moment. The Every Child Matters agenda, the Children Act 2004, will give us an agenda for 2 or 3 years at least, where a lot of what has been our firmament is shifting. Social work and social care need to align themselves differently with other disciplines and other professions to improve outcomes for children. If we do that without fully understanding what it is we do well, what it is we do that works, then we are going to let down a cohort of children. The need is for us to enhance our knowledge and research and evidence base, rather than assume, if we're moving into a different way of offering multidisciplinary and interagency services, that we can do less of it. We have to know much more clearly what it is we do well if we're going to work more closely alongside other disciplines.
So the simple way to talk about it is, are you sure you're basing the decisions you're making as a practitioner on a sound knowledge and evidence both about what works but also about what doesn't work? And what are your sources? How do you know that? And is that challenged regularly and routinely in peer groups, in supervision with your manager, in discussion about developing services, or changing the way you do things now? And what are your sources? Where do you go to ensure that your professional development, your continuing professional development, takes account of new learning and new knowledge and new evidence about what works and what doesn't?
For me, evidence-based or evidence-informed practice doesn't replace kind of intuition, professional intelligence, and the kind of intuition that people act on in their day-to-day jobs. So for me, evidence-informed practice would actually incorporate both formal, academically driven research plus people's knowledge about their day-to-day experience of delivering services.
Social workers traditionally had a problem about recognising that they had the knowledge inside, but they needed to share it. And also that the knowledge we have is as important as the knowledge other partners, such as people working in the health sector, in other parts of the public sector like the police, the probation service, had. And I think one of the greatest things that's happened as training has improved is the greater understanding of social workers that they need not only to gather knowledge for themselves and from themselves, but with others in the arena of health and social care.
I suppose the role that I would have would fall into kind of many facets. I mean, first of all, I think I've got a real challenge in engaging staff and kind of winning commitment to the concept of evidence-informed practice and making sure that people understand what it means and how it's relevant to what they do.
You can absolutely require a culture that demonstrates continuous learning and values learning and invests in learning. And if you don't set that framework and that set of expectations through your senior management, then you can't expect it to happen at the front line, or for people to either free up their time, because that's difficult. Making time for learning is difficult. People are tremendously hard pressed. But to not only make it possible, but to make it essential and a requirement, and a message that this organisation can't be high-performing and can't grow and develop if you lose that thirst for knowledge and that thirst for learning.
I think local authorities, particularly at a senior management level, need to have a kind of strategic approach to this. And one of the things that Research in Practice taught me many years ago is the distinction between research literacy and research competence. And I suppose what I'm looking for primarily with my own staff are for people to be research literate, i.e. I would like them to be able to know where to go to find information about the services that they deliver. And I'd like them to be able to read stuff and understand it and be aware of how they might apply it to their work.
That means accessing published evidence. It means ensuring that team managers have the support they require to challenge work that isn't evidence-based, and some of that comes at a relatively low cost. Some of it's more expensive, but we actually need to build into our systems the rigour of challenging people to explain why they're doing what they're doing.
The policy making, of course, rests with elected members. And part of what we try to embed in the thinking of elected members is the need to have a fully skilled staff working to be evidence-based. I suppose for them they have, if you like, something of a dichotomy, because the soundbite, which might appear to be attractive for the voter, may not quite match up sometimes with the reality of what evidence is. But we see it as our task, if you like, to negotiate that slight chasm between reality and evidence, and that's what I think officers are there for.
As a senior manager in Wrexham, what I've been trying to do is to agree a strategy about evidence-informed practice and to try and discern within that what my responsibilities are as head of service, what the responsibilities of middle and first-line managers are, and what practitioners can do.
If the team manager has the capacity to look elsewhere, not just within their own resources, but to those that exist outside, to challenge their staff to think differently, do better, then if we don't do that, then services won't continue to improve. We won't deliver improved outcomes. We won't deliver what is our local agenda, what is every council's local agenda, which is to reduce inequalities, to prevent social exclusion, to prevent harm.
I suppose I start from the very simplistic premise that being part of a profession means that you actually need to devote time to be able to do this. And I also believe that nobody gives time to us. We organise our own time in that sense. And I think for practitioners and their managers in particular, there's an issue about actually how they build time into a very punishing schedule, and it's far from easy to actually make sure that they keep abreast of what's going on and that their practice is actually informed by information that's around.
People are tremendously stretched at the front line, so you have to build that in through manageable workloads, through management that understands why it makes a difference and how dangerous it is not to be evidence-based, not to be knowledge-based. We're doing the sorts of work that impacts on people's real lives, and it's not safe practice not to be up to date with your knowledge. So you must find a way of making that part of your working life.